Welcome to the online course for high functioning autism. This is an SDR opportunity for All Pleasanton Unified staff. We're going to start by going over just a few statistics to help familiarize you with high functioning autism. 1 in 68 children are on the autism spectrum. We also know that autism is 5 times more common in boys than girls, and we know that it equally affects children of every race, socioeconomic status, and region of the country. There has been a 10-fold increase in the prevalence of autism in the last 10 years. Although this seems discouraging, it is probably primarily due to the fact that there is an increase in awareness of autism and expansion in the types of children who receive an autism spectrum diagnosis. This is a good thing because it means more students are getting the treatment that they need. However, there's also a suspicion that there's actually a rise in cases. So people with systemizing brains are finding each other and creating a genetic predisposition towards producing higher rates of high functioning autism spectrum disorder in their offspring. And social trends like older parents having children, which is one of the things that can increase the risk of having autism, is more prevalent today. This is the clinical diagnosis for autism spectrum disorder according to the DSM-5. So, persistent deficits in social communication and social interaction across multiple contexts, deficits in social emotional reciprocity, deficits in nonverbal communicative behaviors used for social interaction, and deficits in developing, maintaining, and understanding relationships. So it's important to note that not every exceptionally gifted person and not every socially inept person has high functioning autism spectrum disorder. So an autism spectrum disorder diagnosis is only properly made when a person is experiencing clinically significant impairment in social, occupational, or other important areas of current functioning. Autism spectrum is on a continuum. So as people with autism do not all experience the same symptoms, mental health professionals diagnose individuals with autism according to a spectrum of severity. So it goes from disabling, severe, becoming more severe, moderate, mild, very mild. Mental health practitioners diagnose individuals with low functioning autism when they present symptoms located on the low or more severe end of the spectrum. Individuals with high functioning autism present with milder symptoms and an increased ability to communicate and self-regulate their behavior. High functioning autism is neither an official diagnosis, and there's not necessarily an agreed upon definition of what the term means, but in the broadest sense of the term, high functioning autism could mean any of the following. A person with relatively mild symptoms, so despite their mildness, they're significant enough to merit an autism spectrum disorder. A person with autism whose IQ is higher than 70, a person with autism who's successfully navigating a typical school or work environment, a person who is able to mask symptoms of autism successfully so they have in expected ways and can pass a lot of times for neurotypical, and a person who at one point had an Asperger's syndrome diagnosis. As with any mental health diagnosis, there are a lot of myths and facts that are circulating, and so we want to take some time to go over what some of these myths are and address them with the facts. The first myth is that a student with autism is not going to be able to learn. So while some school tasks, especially those involving abstract thinking, are going to be really difficult for the student to grasp, there's other tasks that are entirely within the realm of learning, like memorization. So some autistic students are very strong students in particular areas like math or geography. The second myth is that people with high functioning autism are unusually smart and successful. There's a lot of famous people that are considered eccentric geniuses, like Bill Gates and Albert Einstein, that are considered on the high end of the autism spectrum that are often mentioned. People with high functioning autism, while they may or may not be unusually intelligent, rarely have the kind of intense motivation for public success that sends a Bill Gates to find funders or an Einstein to find a publisher. They might also have significant challenges which stand in the way of living a comfortable life, succeeding in work or romance, or achieving a sense of self-worth. These issues are made more challenging in part because they surprise and upset others who don't anticipate their odd behaviors or reactions from people who pass for normal in a lot of situations. So while people with more severe autism are not generally expected to just suck it up and get through difficult moments, people on the higher end of the spectrum are expected to do just that. The third myth is that autism is a deficit. People living with autism possess a lot of strengths, and these are just some of the few that I want to mention. The first, attention to detail, often highly skilled in a particular area. They can get really deep into study, resulting in encyclopedic knowledge on areas of interest, so the tendency to be logical can be really helpful in decision making where emotions might interfere for a lot of people. They often have less concern for what other people may think of them, so this can be a strength and a challenge, as you know. They're also known as independent thinking. So this can often result in novel big picture insights due to different ways of looking at things, ideas, and concepts. They're usually really good at visual processing, so they think in pictures or videos. And they're often average to above average academically. The last myth is that it is really not necessary for a student to be formally diagnosed. In reality, there are several reasons why having a diagnosis is important for your child. We're not trying to label children or give them this identity, but a thorough and detailed diagnosis provides important information about your child's behavior and development. It can help create a roadmap for treatment by identifying the student's specific strengths and challenges and providing useful information about which needs and skills should be targeted for effective intervention. And a diagnosis is often required to access autism-specific services through the school district. Until 2013, many people who might have been said to have high-functioning autism were diagnosed with either Asperger's syndrome or pervasive developmental disorder not otherwise specified. However, there are differences that set the two diagnoses apart. Asperger's syndrome was a distinct diagnosis which described a person of average or higher than average intelligence and age-appropriate language skills who also had significant social and communication challenges. Whereas pervasive developmental disorder, not otherwise specified, was kind of a catch-all diagnosis, so it was often understood to mean the same thing as high-functioning autistic, because it really incorporated individuals at all functional levels whose symptoms didn't fully correlate with classic autism. However, with the release of the DSM-5, instead of separate diagnoses, there's just one big group of people diagnosed with autism spectrum disorder. It's really important to note that some people have experienced quite a bit of positive identity from the term Asperger's, so if they want to keep using it as a way to identify with others, that's totally fine. However, people with autism are still very different from one another. So to clarify these differences, the DSM-5 also includes functional levels. So people who are bright and verbal are generally given the diagnosis of level 1 autism spectrum disorder. Still, the distinction doesn't offer a clear characterization of what level 1 autism spectrum disorder actually is. So for example, people with level 1 autism spectrum disorder can show affection, complete daily tasks, and use age-appropriate language, reading, and math skills. On the other hand, they can't hold eye contact, maintain a conversation, engage in play, or pick up on social cues. People with level 1 autism spectrum disorder can have significant speech and language delays, but are able to take part in an inclusive academic program because of their age-appropriate academic skills. So what is needed for an autism diagnosis? There are two domains where people with autism spectrum disorder must show persistent deficits. So there's challenges with social communication and social interaction, and then there's restricted and repetitive patterns of behavior. The DSM-5 has an additional category called social communication disorder, and this allows for a diagnosis of disabilities in social communication without the presence of the repetitive behavior. So social communication disorder is a new diagnosis and much more research and information is needed. More specifically, people with autism spectrum disorder need to be able to demonstrate either in the past or the present deficits in social emotional reciprocity, deficits in nonverbal communicative behaviors used for social interactions, deficits in developing, maintaining, and understanding relationships. In addition, they have to show at least two types of repetitive patterns of behavior. So these can include stereotyped or repetitive motor movements insistence on sameness or inflexible adherence to routines, so they're highly restricted, fixated interests, and then hyper or hyporeactivity to sensory input or unusual interest in sensory aspects of the environment. Who can diagnose? Well, there's not typically one person that's going to diagnose someone with autism spectrum disorder. You want it to be a multidisciplinary team effort. So, child psychologists, child psychiatrists, speech pathologists, developmental pediatricians, pediatric neurologists, audiologists, physical therapists, and special education teachers. You want input from all these people before a diagnosis is formally made. This is a visual of what the assessment process typically looks like. So first there would be a parent interview, and the first phase of the diagnostic evaluation, you're going to give your doctor background information about your child's medical, developmental, and behavioral history. If you've been keeping a journal or taking notes on anything that's concerned you, this would be a great time for a parent to share that information. The doctor's also going to want to know about the family's medical and mental health history. Next, there's going to be a medical exam, and so the medical evaluation includes a general physical, a neurological exam, lab tests, and then genetic testing. So the student's going to undergo this full screening to determine the cause of his or her developmental problems and identify if there's any coexisting conditions. There's also going to be a hearing test. So since hearing problems can result in social and language delays, they want to be excluded before an autism spectrum disorder diagnosis can be made. The student's going to undergo a formal audiological assessment where he or she is tested for any hearing impairments as well as any other hearing issues or sound sensitivities that sometimes co-occur with autism. Then there's going to be observation. So a developmental specialist is going to observe your child in a variety of settings to look for unusual behavior that's associated with autism spectrum disorder. So they might watch the student playing at school or interacting with other people. And then there's going to be a lead screening. So because lead poisoning can cause autistic-like symptoms, the National Center for Environmental Health is really recommending that all children with developmental delays be screened for lead poisoning. And then depending on on the child's symptoms and severity, the diagnostic assessment could also include things like speech, intelligence, social, sensory processing, and motor skills testing. So these are going to be helpful in not only diagnosing for autism spectrum, but also for determining what type of therapy would be beneficial for them. First and foremost, we know that there's no one cause of autism, just as there's no one type of autism. However, most cases involve a complex and variable combination of genetic risk and environmental factors that influence early brain development of a child. Over the last 5 years, scientists have identified that there's a number of rare gene changes or mutations associated with autism. And research has identified that more than 100 autism risk genes exist. In around 15% of cases, a specific genetic cause of a person's autism is able to be identified. So in the presence of a genetic predisposition to autism, a number of non-genetic or environmental influences further increase a child's risk. The clearest evidence of these environmental risk factors involves events before and during birth. It's important to keep in mind that these factors by themselves do not actually cause autism. Rather, in combination with genetic risk factors, they appear to modestly increase the risk. So, these include advanced parental age at the time of conception, so advanced age of both mom and dad, maternal illness during pregnancy or extreme prematurity, very low birth weight and certain difficulties during birth, particularly those involving periods of oxygen deprivation to the baby's brain. And mothers exposed to high levels of pesticides and air pollution can also put them at higher risk of having a child with autism spectrum disorder. So while the causes of autism are complex, it is abundantly clear that it is not caused by bad parenting, and that's a myth that we've really had to dispel. There's several accompanying disorders that are often seen along with autism spectrum disorder. So seizure disorders, also called epilepsy, occurs in as many as 1/3 of individuals with autism spectrum disorder. And epilepsy is a brain disorder that's marked by recurring seizures or convulsions. Experts are proposing that some of the brain abnormalities that are associated with autism are also contributing to the seizures, which is why they're often seen together. These abnormalities can cause changes in brain activity by disrupting neurons in the brain. And neurons are cells in the brain that process and transmit information and send signals to the rest of the body. So, overloads or disturbances in the activity of these neurons can result in imbalances that are causing the seizures. There's also a lot of genetic disorders that we see accompanying autism spectrum disorder. So, some children with autism have an identifiable genetic condition that affects brain development. These genetic disorders include Fragile X syndrome, um, chromosome 15 duplication syndrome, and other single gene and chromosomal disorders. And while further study is needed, single gene disorders appear to affect 15 to 20% of those that have autism spectrum disorder. We also see a lot of gastrointestinal disorders, so surveys have suggested that between 46 and 85% of children with autism have problems like chronic constipation or diarrhea. And then sensory integration dysfunction. Many children with autism experience unusual responses to sensory stimuli or input. So these responses can be due to difficulty in processing and integrating sensory information. Vision, hearing, touch, smell, taste, the sense of movement, and the sense of position can all be affected. So even though the information is sensed normally, it may be hard for them to process. We also see that because of autism spectrum disorder, there can be a lot of mental health accompanying, sleep dysfunction, and pica. There's many common struggles that someone with high-functioning autism might deal with. So extreme sensory issues. People at the higher end of the spectrum are just as susceptible as people in the middle or lower end of the spectrum to sensory dysfunctions. So this can include mild, moderate, or extreme sensitivity to noise, crowds, bright lights, strong taste, smells, and touch. This means that a person who is bright, verbal, and capable can also struggle with walking into a crowded restaurant, attending a movie, or coping with the sensory assaults associated with malls, stadiums, or other venues. Social cluelessness can also be a challenge. So, what's the difference between a civil greeting and a signal of romantic interest? How loud is too loud? When is it okay to talk about your personal issues or your interests? When is it important to stop doing what you're doing in order to attend to another person's needs? These are all tough questions for anyone, but for a person on the high end of the autism spectrum, they can become overwhelming obstacles that really interfere with social connections, employment, and romance. Anxiety and depression are more common among people with high functioning autism than they are among the general population. We don't know whether the autism causes the mood disorders or whether the disorders are the result of a lot of the social rejection and frustration that people on the spectrum experience. But whatever their causes, mood disorders can be disabling in themselves. There's also a lack of executive planning skills. So, executive functioning describes the skills that we use to organize and plan our lives. So, this is what typical adults use to function in their everyday life, and this is more challenging for students on the spectrum. Emotional dysregulation, difficulty with transitions and change, and then challenges with following verbal communication because they're very visual learners can be a challenge. There are many research-based interventions that can be effective for students on the autism spectrum. While autism is usually a lifelong condition, all children and adults are going to benefit from interventions or therapies that can reduce symptoms and increase their skills and abilities. Although it is best to begin intervention as soon as possible, the benefits of therapy can continue throughout life. The long-term outcome is highly variable. A small percentage of children do lose their diagnoses over time, while others are going to remain severely affected. What we know to be research-based interventions for students on the spectrum include cognitive behavioral therapy, behavior therapy, pharmacological intervention, so medication, adaptive training or instruction, social skills training, and then training in self knowledge and self advocacy skills so that students understand what this diagnosis means. This is a really impactful quote that I think we need to keep in mind when working with all students, whether or not they're on the spectrum. A lack of learning in any particular situation should first be interpreted as a result of the inappropriate or insufficient use of teaching strategy rather than an inability on the part of the learner. We really need to focus on what can we do differently in this situation. Obviously, there's things the student could do differently, but our role as teachers, as educators, as counselors, as social workers, as psychologists is to really focus on what can we do to help adapt to the student's specific and unique needs. The Organization for Autism Research offers a series of 6 easy steps to help students that have high functioning autism succeed in the classroom. The first is to educate yourself. Understand what autism spectrum is. You guys are already taking that first step by taking this course. Second is reach out to the parent or guardian. Try to meet with each student's family or caregivers before the school year begins and talk with them about the child's interests, behaviors, and challenges. Communicate with these individuals regularly throughout the school year using a mode of communication that works well for them. So maybe for working parents, email is going to be the best way to get a hold of them. Maybe for parents that are not working outside of the home, they have that availability for a phone call during lunch. Ask each student's family members or caregivers about visual, auditory, or olfactory sensitivities that the child experiences so that you can avoid, burning candles or spraying air fresheners, for examples, that might trigger the student. Learn about anything that is particularly stressful for the student, and likewise learn about any adaptations that have in the past successfully helped the student to excel in the classroom and work to implement those supports. Since these individuals experience various communication difficulties, do not rely on students with autism to relay important messages to their parents about school events, assignments, school rules, etc., unless you try it on an experimental basis with follow-up. Okay, so even sending home a note for his parents might not work. The student may not remember to deliver the note, or it could get lost before it reaches home. So, phone calls to parents are going to work best until that skill can be developed. And frequent and accurate communication between the teacher and the parent is super important. The next is prepare the classroom. So, talk with the students in the class about physical or motor challenges that the classroom environment may impact, and consider ways that you could mitigate these challenges in the classroom's physical space. Talking to the student and family about what do you need in our classroom? What do you see as potentially being a barrier for you? So maybe keeping rows between desks wider or sitting the student close to resources that he or she will need frequently, like the pencil sharpener. Educating the student's peers and promoting a social goal. So letting other students in the class know what is autism. Obviously, you want to be sensitive about how you do this so it's not embarrassing for the student that's on the spectrum. Collaborate on the educational program development. So make sure you're working closely with the other specialists that are supporting this student. And then lastly, manage behavioral challenges. So we're going to get more into ideas of classroom supports that we can offer students. We're now going to go through a number of specific ideas for how we can support students on the spectrum in the classroom setting. Students with autism tend to insist on sameness and also find a lack of predictability really stressful. Accordingly, the use of individualized schedules can help students with high-functioning autism stay on track, understand, accept, and follow the sequence of daily events, and adapt more flexibly and smoothly to the inevitable changes that are going to happen in the daily routine, as well as decrease transitional difficulty. So it's super helpful to have a schedule posted in the room and, have time frames and visual pictures that help know what's coming next. Teachers should also communicate transitioning from one task or activity to another to the student with high functioning autism carefully and in a series of steps. So, the first step could be assisting the student with stopping his or her current task. Students with high functioning autism might need help understanding and locating a good stopping point, so you can help them by clarifying how this could look. So, for example, instructions such as complete the page you're on, complete the page you're currently reading, then put your book away and wait patiently, or stop writing in 15 seconds and I'll count down slowly. It can be super helpful. Number 2, prepare the student for the new task. So communicate clearly what the next task will be and how things fit in the daily schedule so that students can prepare mentally for the change. You might post the daily agenda on the board for students to see and remind them verbally throughout the day. So for example, we'll read until 10 a.m. and then we're going to get ready to go to the gym for PE. Number 3, helping the student begin the new task. So giving the student a small amount of individual time with you as soon as an activity begins to make him or her feel comfortable with getting it started. And lastly, coaching the student through wait time. So wait time during transitions can be really difficult for students with high functioning autism. For example, they might find it hard to sit still and be quiet while you hand back graded papers. So to assist with this, talk with them about things they can do during these times. For example, they could draw a picture or recite a favorite poem in their mind. There are a number of adapted instructional strategies that can be used as well. Researchers suggest that the use of simple languages and short sentences with slower speed can help clarify instruction and expectation to students with high functioning autism. In addition, using written information can be really helpful. Basically, students with high functioning autism are visual learners, so they can't really benefit from traditional verbal instruction. Based on their relative strengths in visual spatial processing, the use of written information is going to be one of the most effective ways that we can teach this population. So visual aids, including written task directions, written cues, maps, pictures, handouts, and checklists, providing the target students with a lasting visual reminder are going to be more effective than instructional languages and other presentation styles. And lastly, taking advantage of any special interests they have. So students with high functioning autism usually have strong interest in some special objects or topics, and some researchers emphasize it's important to utilize their special interests to develop academic and career skills, rather than stamping them out. In addition, these special interests can also be used to reinforce less preferred activities, as well as to make the school environment more appealing. In addition to modifying instructional strategies, we can also modify the learning environment. Offering preferential seating and providing an independent work area for students with autism is always encouraged. Another way to modify learning environments would be to use organizational work systems. So, for example, the use of containers with written labels is a simple but effective way to organize tasks for students. Another organizational support would be like organizational notebooks and written directions can be really helpful in promoting independence in students with high functioning autism. And then supporting this child in developing and honing his or her organizational skills. So encouraging the student to use a classroom binder or folder to keep his or her own work organized. They could either carry it with them or keep it in the classroom. It's important to keep in mind that even a straight-A student with autism who has a photographic memory can be incapable of remembering to bring a pencil to class or of remembering a deadline for an assignment. In such cases, aid should be provided in the least restrictive way possible. Strategies could include having the student put a picture of a pencil on the cover of his notebook or maintaining a list of assignments to be completed at home. We always want to praise the student when they remember something that they had previously forgotten as positive reinforcement. Peer-mediated interventions are also proven to be effective. So this can also be referred to as peer tutoring, and it can be divided into 3 levels. So class-wide, small group, and one-to-one. Matching a child with disabilities with a typically developing peer or partners has the following advantages. 1, it provides a reciprocal and more learner-friendly environment. You're presenting more opportunities to receive positive and corrective feedback, individualized help, and encouragement. Students prefer peer teaching practices to traditional student-teacher instruction a lot of the time. A typical peer is able to make adaptations when interacting with peers at lower developmental levels, which is going to increase the likelihood of successful interactions. Facilitating generalization of the learned skills across settings and people. And typical peers may also benefit academically and/or socially from such peer interaction. There is a proposed criteria for selecting typical peers that are going to be supporting students on the spectrum. And these would be, you want to look for someone that's demonstrating age-appropriate language and social skills. You want someone that's going to be familiar with the target participants and interact positively with the target participants in the natural setting. And then you want to find someone that's going to be able to follow adult direction and is going to be able to support their peers. Research has also found that the use of video monitoring, so including self-modeling and peer modeling, can have a really great positive impact in the areas of social communication, daily functioning skills, and the academic performance on students with various disabilities. It can be used to teach social skills to children on the autism spectrum, and it can be used to teach new daily functioning skills to individuals with autism, so grocery shopping, things like that. Research has shown that the use of positive behavior supports is an effective way to manage challenging behavior. PBS involves identifying the function of a problem or a challenging behavior and then teaching the individual new skills to help correct the behavior and respond with a positive one instead. Therefore, it involves creating a structured plan that positively addresses behavior. We need to recognize that behavior is communication. We need to try to understand the communicative intent of the behavior and teach the student appropriate ways that they can communicate and give them positive reinforcement when they're successful in doing that. It's really important to understand that most human behaviors serve a purpose, and as a result, a lot of your child's or your students' challenging behaviors have underlying causes. So let's work with our students and his or her therapist to try to identify those causes so that we can develop a plan to use to teach him or her the positive skills and behaviors that can be used to respond to the issues at hand. We need to look at each situation from the student's perspective. What is happening that could be causing him or her to respond in this way? While a pat on the back or a round of applause is an obvious indication of a positive behavior to a neurotypical child, children with autism may need additional motivation or reinforcement to understand the response a behavior elicits. Following up a behavior with positive reinforcement, like specific verbal praise or a reward, is going to make the student more likely to repeat the same behavior in the future. This system is an example of something that can help the student gradually build on simple skills like eye contact in order to help with more complex social situations. Cartooning is another strategy that instructors can use to teach social skills and behaviors to students that have high-functioning autism. So when you're using cartooning, the teacher or school faculty member might first draw a social situation using simple stick figures and like conversation bubbles, and then they can invite the student to add or talk about the cartoon. This strategy can also help students with high-functioning autism describe and plan for the social situations that they might find difficult. So for example, communicating what they would like to eat in the lunch line. Conversation starters and scripts can also be helpful in the context of the classroom for students with high-functioning autism. Beginning and maintaining conversations requires certain skills and flexibility that students that have high-functioning autism might lack, and so conversation starters can help them in these interactions. You might post these conversation starters somewhere in your classroom, and if this is appropriate for all your students, you might also work with students with high-functioning autism, helping them to develop their own conversation starters that they can write on small note cards, and they can reference those in and out of the classroom. Like conversation starters, scripts can also help students to manage conversations that might be stressful for them. So they could have written out sentences or phrases that the student carries with him or memorizes in preparation for use when it might be needed. A sample script may look something like this. If I can't find my bus in the bus line after school, I can go to a teacher and say, "My name is David and I ride bus 3 to get home. I cannot find bus 3 today. Will you please help me? Thank you." In stressful situations, scripts are going to be especially beneficial because they can help a student with high-functioning autism to remain calm and communicate his or her needs to other people. A social story is a short story that's written from the student's perspective and can be used to help the target student better understand complex and confusing social situations. So if they have difficulty understanding others' thoughts, mental states, desires, and intentions, these deficits are believed to be responsible for the poor social communication skills that a lot of children with high-functioning autism have. So we can provide information on what people in a given situation are doing, thinking, or feeling, And the sequence of events, the identification of significant social cues and their meanings, and the scripts of what to do or say can be really helpful. There's a few steps to creating a social story. So you're first going to want to identify a target behavior or a problem situation for a social story intervention. Then you're going to define a target behavior for data collection. You're going to collect baseline data on the target social behavior, and then write a short social story using descriptive, directive, perspective, and control sentences, and then place 1 to 3 sentences on each page. You can use photographs, hand-drawn pictures, or pictorial icons. And then you're going to read the social story to the student and model the desired behavior. Afterwards, you can collect intervention data and then review the findings and related social story procedures, and then program for maintenance and generalization. So in another module, we're going to have an example of a social story so you can see how this plays out, but this is like the script of an example social story. So sometimes in class, I have a question. When I want to ask a question, I raise my hand and I wait until the teacher calls my name. When the teacher calls my name, that means it's my turn to ask my question. I will put my hand down and ask the teacher my question. The teacher will do her best to answer my question. I will try to listen carefully for her answer. Sometimes the teacher will not have an answer. That is okay too. I will try to wait patiently and quietly until my teacher calls on me to ask my question. Students with high-functioning autism may also benefit from and enjoy the peer interaction that's going to be provided by a lot of extracurricular activities and clubs. We can work with these students to help them to discuss what these opportunities might be for them and support them in selecting and joining where they might feel most comfortable. We want to make sure that they have, experience a fit with the classes that they're in. For older students, there are frequently times when their schedule is going to include elective classes. And so before asking students to attend these classes, we should work with them to ensure that these classes actually fit their interests and their comfort levels. We want to add a little don't forget caveat here as far as puberty and sexuality. So just as typical students grow up and must learn about the facts of life, so too must students on the autism spectrum. So while they might have differences in their behaviors and communication, the students' bodies are progressing in growth and development at the same rate as their chronologically aged peers. So when their peers begin to learn about puberty, dating, and sexuality, so too should students that are on the spectrum. Without prior discussion, it's only going to be too easy for students to ask with the typical bluntness about those questions and their concerns that could be better discussed in a private they could be better discussed in private than in front of the rest of the class. Something scary happening with his or her body can be a really, reasonable cause for a student to have a stress reaction at school that disrupts the learning environment. So we want to prepare the student ahead of time, and parents and caregivers need to be encouraged to talk with the student initially, but they might need suggestions from educators on how to do this in a way that the kid's going to understand, and also encourage them to discuss these changes before they actually occur for the student. Some ideas of how to have these discussions with students would be to use pictures or other visual supports of the body changes, use correct terminology for the body parts, provide checklists of healthy behaviors like using deodorant in the morning after the gym, changing underwear daily at home, and things like that. Lastly, because transitions are challenging for students on the spectrum, we really want to make sure that we're preparing them for transitions from home to preschool to elementary school to middle school to high school to post-secondary. These are all vital for students. So when having discussions with students about the future, we want to talk about what change is going to happen and where and when it's going to happen. We also want to talk about what needs to be done and who specifically is going to be in charge of doing those things and when. How the student has coped with other transitions that have happened in their life, what things have helped them cope in the past with other transitions. So for example, visual support, social stories, transition stories, sensory supports, short movies, and so on. And then how your student can be supported during the school day once they've made the transitions. We hope this has been an informative online training for you on the topic of autism spectrum disorder. There's a few more modules with some supporting videos that you can check out, but these are some references for you to view as well if you want to do any further research based on the information provided on these slides.